Hello everyone, welcome to Sapiomed tutorials. Before we begin this short video, I would like you to hit on the subscribe button to subscribe to this channel. Alright, so let's deal with this case study question. So first of all, when you want to diagnose a disease, you have to consider three things. First, the clinical history of the patient. We're also going to consider physical examination and also laboratory results. So you're looking for history, you're looking for physical examination, and you're looking for laboratory results. So when you take this case study question, you could see that one of the clinical history is the fact that the patient has a normal hemoglobin variant and also a normal G6PD enzyme. Okay. And you also consider the patient's physical examination as well. You could see that there was a pallor in the conjunctiva, and also there was this characteristic spooniness, which is also known as koinomentia. Alright. And also you also have to consider, under the clinical history, you also have to consider the clinical manifestation. So the patient was complaining of shortness of breath, and then was also complaining of profuse menstrual bleeding. So all of this one, it should tell you that it got to do with loss of blood. Alright, so your mind should be geared towards anemia. So after considering the medical history and then the physical examination, you are going to consider the laboratory results, which is one of the main diagnostic criteria you have to consider when you are diagnosing the disease. So looking at the laboratory results, you will see that hemoglobin level is low. You can see that mean cell volume or mean corpuscular volume, which is the MCV, is low. You could also see that under the iron studies, you could see serum ferritin is low. You could see ferrum transferrin, or what we call total iron binding capacity, is so high. You could also see serum iron to be very, very low. So all of this one suggests what we call iron deficiency anemia. So first of all, it's not any other type of anemia because the patient has a normal hemoglobin variant, the patient has a normal G6PD enzyme, and then looking at the parameters, you cannot say it's a megaloblastic anemia because the MCV is low, and for megaloblastic anemias, MCVs are high. And aside the full blood count, you could use the iron studies, that's the serum ferritin, the serum transferrin, or the total iron binding capacity, and then the hemosiderin to confirm your diagnosis, or the